understand the background here at Palo Alto Medical Foundation. So a lot of pressure for his organization being in Silicon Valley and treating patients that work in some of the more advanced digital industries. So with that, let's turn it over to Dr. Chan.
Hi everyone, it's Albert Chan. I'm here to talk with you today, the CDO influence and patient experience. I think we can all remember back in March when the stay-at-home orders for COVID-19 first happened. This is a slide that reminds me of what in our state, California, Governor Newsom issued the stay-at-home order. And I started to get to thinking, what in our lives has changed because of COVID-19? For example, for the first time, I've taken advantage of contactless curbside pickup. It's a new experience for all of us. And for the first time, I ordered DoorDash food via a mobile app. Again, a digital experience. What's remarkable is what companies have changed and survived and thrived versus what companies have not during the pandemic. So you can see on the left, some companies like Tractor Supply, Lululemon, Microsoft have thrived during COVID-19. But others, including historic brands like Brooks Brothers and others, when you're forced to be socially distant, your sales do suffer. And my commute has certainly changed. It used to take me 2+ hours to drive to our headquarters in Sacramento, and now it takes me all about 1 minute to comb my hair and get out of bed and come to my office. And I learned something very different about Zoom and teleconferencing, and I've developed the Zoom face just to remind us of how life has changed. This brings up a broader point of what I'll call the fourth industrial revolution. You can see in this graph here, this is actually, I borrowed a slide from Dr. Eric Topol. And I think the fourth industrial revolution is here. That really artificial intelligence, big data, robotics, and most importantly, digital is here to stay and is going to profoundly influence the way medicine is practiced today and to the future. Why do I think this is so important? Let's look at this graph. This graph shows data in our electronic health records. As you know, over the last several years, the United States has gone through a transition where we've essentially digitized all our records into the electronic health records. What's interesting about this data inside the electronic health record is who accesses that data. And in green shows the access by doctors and nurses and other care team providers, and in blue shows access by patients. So this graph shows me the profound influence of patients in the patient experience and the need for us to empower them with digital solutions, technologies. Now we all have to admit patient experience is quite complicated. This graph just shows the complexity of medicine and navigating care. And we at Sutter Health have really tried to determine what are the barriers, what are the things that get in the way and the impediments to getting great care in our care processes. As you can see here in this graph, medicine's complex. Whether trying to book an appointment or pay a bill or other things of that sort, it often is very, very challenging. And in my opinion, the only way to solve this really at scale is digital. So much so is we've actually taken an opportunity to take a hard look at our patient journey from end to end, from pre-service to time of service and post-service, and say, hey, what if we fundamentally map out each one of the steps? Can we, essentially to improve patient experience and the efficiency of our care practices, can we digitize each step of the patient journey in some way? Either looking for automation or self-service, or just reduce the barriers to care that exist today. I'm going to share with you some examples. First, I would like to highlight this picture, which is the bridge to nowhere. And I will argue that if you don't essentially map out your care processes and understand what are the barriers to your care delivery, you'll essentially build this great digital bridge, but it'll be a bridge to nowhere. So one of our focuses is really to say, can we highlight and understand what our practices are today, and can we leverage workflows and optimize workflows to take advantage of digital? I'm going to share with you some examples. So during COVID-19, you've by now all heard the term personal protective equipment, or PPE. In some sense, because in my opinion, everything is touched by digital, we created this term digital personal protective equipment, or digital PPE. And these are multiple steps we took to try to make the lives of patients safer in our care institutions. So for example, we added AI navigation to make it easier for patients to navigate to care 24 hours a day, 7 days a week. We added video visits so the patients could receive care no matter where they were in the state of California. We implemented contactless check-in. The idea there, you could perform any of the same functions like checking in for appointments, signing documents, and even being alerted automatically in your care center that you've arrived, so that you can minimize the time you sit in the waiting room for care services. And we've even extended this concept to our employees using a QR-based employee COVID screening to improve safety and screening. Let me share with you now some data that we've achieved with some of these initiatives. Here's a slide that shows our AI symptom navigation tool. We have a partnership with a company called Ada, and the goal is really to have the patient find the right care location, type of care for the right condition. Essentially how this works is patients navigate with this AI symptom checker 24 hours a day, 7 days a week, have a conversation with Ada, and then instead of replacing doctors, essentially what they get is symptom advice to where to get care and what type of care. And it essentially is more efficient for both parties because obviously patients want to be navigated to the right place inside of care. As you can see on the graph here, on the left is our average assessments per day prior to COVID-19. And you can see up to 181% increase in assessments after COVID-19. The beauty about this is we essentially added several hundred assessments per day without adding a single doctor to our mix. And this provided robust advice for our patients. And super majority of our patients rated this as highly useful and helpful as they navigated care. Perhaps more striking than that is our experience with telehealth. As you all know, as many care systems around the country experience, telehealth has really changed the landscape with regard to care, and virtual care is, I think, here to stay. Here's some data that shows our transition and what happened. Essentially, prior to COVID-19, we used to perform about 20 video visits per day, fairly modest number. After COVID-19 started, we ramped up to a peak of 7,000 video visits per day. We went from 50 physicians being able to provide video visits to over almost 4,700 video visit practitioners. As a percentage of total appointments, we used to do less than 1% of our appointments done by video visits, and at peak we did up to 30%. And truly expressing the power of digital, we went from a rollout plan that was slated to take 2 years, and we got it done in 4 weeks. To me, that's only made possible by digital training. So we essentially created new training models. Instead of in-person training, we had virtual trainings, up to 5 sessions per day to fit doctor schedules. We had central deployment. So to ready our devices for technology for our physicians, we essentially onboarded 4,000 plus iPads centrally, loaded the software we needed, and then deployed them locally to our clinicians. All in a matter of 4 weeks. Again, only made possible by digital, in my opinion. And what happens when you do this? This is some patient satisfaction surveys as a measure of a net promoter score. That is, how likely is it for our customers to use the service again and recommend it to others? And you can see here, the data of video visits is on par with our in-person experiences. In other words, in my mind, this is a testament to how well our physicians care for our patients, empowered by digital. Digital creates new opportunities. We are a Northern California-based institution, but you can see here on the graph here, in green is the zip codes where our patients receive care. And though we're in Northern California care delivery system, you can see here in green in different parts of the state, patients sought video visit care, virtual care throughout the state of California. And our lives have certainly changed forever. This is a quote from one of my colleagues, Dr. Srinivasan, who said, "Telemedicine is perhaps the only silver lining of this horrible pandemic. It is transformative. I don't think we'll ever go back to medicine before coronavirus. There's so much time spent interacting one-on-one with the patient. I felt for the very first time, the entirety of the visit was spent caring for the patient without distractions. Over the next few weeks, each and every day will be shaping the way we practice medicine after coronavirus." And Dr. Srinivasan, I couldn't agree with you more. Now, many care gaps remain, and so we have to take new approaches to address care gaps that were created by the pandemic. And I'm going to share some examples, some strategies we've deployed to make that possible. First, I'll show you, I'm going to let you pause a second on this picture to give you a sense of what some of the things that confront us. So what does this picture show? This is a picture of a 24-hour fitness site with stairs down the middle. You'll notice the caution tape across the stairs in the middle and 2 escalators that flank the entrance. We have to think about our care design and think about how we engineer approaches so that it's much more likely to align incentives to get the care outcomes we want. In this case, obviously, the incentive is not to use the stairs for exercise, but rather use this escalator, and that's just the wrong approach. Similarly, if you were an airport bathroom operator in Europe, what would you do to reduce cleaning costs? You might use behavioral economics approaches like putting a little fly in the bottom of the urinal to encourage your customers to use the right approaches. I started thinking about this thinking how can we use this science, this behavioral science, to improve care delivery for our system? And again, delivered by digital. So here's data. We essentially, the two things I'll remark on this slide are, one, digital involves really the ability to rapidly test and iterate. So essentially we followed that same model. We had a phase 1 and phase 2 of this project, whereas phase 1, we took a select group of patients as our test bed, and we said, let's try different behavioral economics approaches to get patients to book an appointment for care delivery. And you can see here, there's email A and email B. We essentially did an A/B test very rapidly. And we said, what theme works better to get our patients to take advantage of our systems to book an appointment? And then once we figured out the winner, which in this case was email B, we extended to over 500,000 patients. And what we saw was using the winning email message, again, delivered digitally to get our patients to book an appointment, we saw a nearly 5-fold increase in online scheduling through this intervention. Similarly, when we looked at screenings, for example, cervical cancer screenings, we said, how can we encourage our patients to get these needed cervical cancer screenings? And how do we reach out to patients digitally? Because obviously, if you had to call patients individually or email letters or other things, it would take a very long time. So instead, we used our digital patient portal and said, what can we do to deliver digitally to get them involved in their care? And you can see here in red, Pap smears, the alert for Pap smears were delivered via traditional methods. In other words, a control group saying you need a Pap smear. And in green on the right, an intervention that encouraged uses of behavioral economics techniques to reach out to patients. And you can see here the test completion percentage was much greater in green versus red. Here's another example. A few years ago, we had an alert. We had this challenge that confronted us, which was, how do we alert patients that they are eligible for hepatitis C screening? And so some of the approaches we thought about were call campaigns or email campaigns or websites or letters. We decided on a digital intervention. What we decided to do is essentially put materials online to explain why you should get hepatitis C screening, and then link an alert inside our electronic health record to prompt, and our personal health record to prompt people that they were eligible for screening. And you can see here on screen what happened once we did that. In blue, you can see the baseline activity of hepatitis C screening prior to the implementation of the alert. And after you put the alert, again, 6 words that said basically you're due for screening for hepatitis C. You can see on the right what happened. Over several 100,000 patients were alerted for those very 6 words. And we actually discovered several hundred cases of patients who needed ultimate intervention for hepatitis C. Again, the power of digital. So I think what awaits us is really a concept like this. This is what everyone thinks of digital. This kind of reminds me of the Matrix, but it's really a digital front door. That's the concept most people have in their heads of bits and bytes and electrons. But I would posit that instead, actually what we're doing is bringing care to the front doors of our patients' homes. Each and every family, different families across the country, adapting to their needs. We have different types of families, different types of environments, different types of homes. And we're able to reach people at scale because of digital. And there's no more gratifying feeling to be able to serve all these patients in our community. I'll close with a concept that happened just before the pandemic, actually. MIT every year highlights the top 10 breakthroughs in 10 breakthrough technologies in the universe. And you'll notice number 2 is hyper-personalized medicine. Again, I'll posit to you that hyper-personalized medicine is only made possible by digital. What we're doing by digital technology is not digital solutions is not to just add technology to the problem and add technology to the solution, but rather personalized experience for each and every patient, extending the best practices and scaling to a population, but ultimately tailoring care to individual patients and their families. With that, thank you for your time, and I look forward to collaborating with you in the future. Thanks so much.
All right, that was awesome, Albert. Just as I expected, amazing examples, very practical. And I would say that probably a good portion of your success that you all have had at Sutter is really because you were pretty well prepared in advance. And I think that really showed all the work that you've done over the years really prepared you for success. So I took so many notes as with every speaker, trying to pull out the big ones. I think the behavioral economics, the idea around behavioral economics was powerful, and how you can really shift people's decision-making and engagement based on that. And I think the examples that you gave with using colors to alert people, and then of course the awesome example of the fly in the urinal. So that was really good. The other thing that you talked about really was physical design as well as just pure sort of digital design, and how the two work together. But ultimately, you also brought it home that it's about the front door, how critical that front door, that's what we're doing with digital, is we're bringing everything to the front door of the people that we serve. And that ultimately, that is why we do what we do, and that is to serve